Question 1. A nurse is caring for a client with a new prescription for warfarin. Which statements indicate that the client understands the teaching regarding this medication? Select all that apply. A. I will use a soft bristle toothbrush. B. I should avoid eating green leafy vegetables. C. I will report any unusual bruising or bleeding. D. I need to have my blood checked regularly. E. I can take aspirin for headaches if I need to. F. I will wear a medical alert bracelet. Answer. I will use a soft bristle toothbrush. I will report any unusual bruising or bleeding. I need to have my blood checked regularly. I will wear a medical alert bracelet. This question tests a client's understanding of safety precautions and monitoring for anticoagulant therapy, specifically warfarin. The keywords warfarin and understands the teaching highlight the need to identify behaviors that prevent bleeding and ensure medication effectiveness. Using a soft toothbrush, reporting unusual bleeding, regular blood checks, PT/INR, and wearing a medical alert bracelet are all crucial safety measures, while avoiding all green leafy vegetables is too restrictive, and aspirin increases bleeding risk. For instance, explaining that consistent intake of vitamin K-rich foods is key, rather than avoidance, helps manage INR levels. Remembering that warfarin increases bleeding risk and requires careful monitoring makes these precautions logical. Question 2. A nurse is assessing a client admitted with fluid volume deficit. Which clinical manifestations should the nurse expect to find? Select all that apply. A. Bounding peripheral pulses. B. Increased urine-specific gravity. C. Jugular venous distension. D. Dry mucous membranes. E. Hypotension. F. Crackles in the lungs. Answer. Increased urine-specific gravity, dry mucous membranes, hypotension. This item evaluates the nurse's knowledge of the physiological signs associated with fluid volume deficit, often referred to as dehydration. The key phrase fluid volume deficit indicates a lack of circulating fluid, which will manifest in compensatory mechanisms and reduced perfusion. A higher urine-specific gravity shows concentrated urine as the kidneys try to conserve fluid, dry mucous membranes indicate systemic dryness, and hypotension results from decreased blood volume, unlike bounding pulses, jugular distension, and crackles, which suggest fluid overload. For example, a client might report extreme thirst and have skin turgor that tense when pinched. Always think of the body trying to conserve water and compensate for low blood volume when you see fluid volume deficit. Question 3. A nurse is caring for a client with a diagnosis of deep vein thrombosis, DVT, in the left leg. Which nursing interventions are appropriate for this client? Select all that apply. A. Apply warm, moist compresses to the affected leg. B. Encourage ambulation as tolerated. C. Elevate the affected leg above heart level. D. Administer prescribed anticoagulants. E. Massage the calf of the affected leg. F. Monitor for signs of pulmonary embolism. Answer. Apply warm, moist compresses to the affected leg, elevate the affected leg above heart level, administer prescribed anticoagulants, monitor for signs of pulmonary embolism. This question focuses on appropriate nursing management for a client diagnosed with a deep vein thrombosis, DVT, with DVT and appropriate interventions being the key phrases. Applying warm compresses, elevating the leg, administering anticoagulants, and monitoring for pulmonary embolism, a serious complication of DVT, are all standard and critical care measures. Ambulation is typically restricted initially to prevent dislodging the clot, and massaging the leg can dislodge the clot and cause an embolism, making those actions inappropriate. For instance, keeping the leg elevated helps reduce swelling and promote venous return, easing discomfort for the client. The main goal for DVT care is to prevent clot extension and embolization. Question 4. The nurse is reinforcing discharge teaching for a client with heart failure. Which instructions should the nurse include? Select all that apply. A. Report a weight gain of more than 3 pounds in 2 days. B. Restrict sodium intake to 2 grams per day. C. Take diuretics as prescribed, even if feeling better. D. Increase fluid intake to at least 3 liters daily. E. Participate in moderate intensity exercise daily. F. Avoid taking over-the-counter medications without checking with the provider. Answer. Report a weight gain of more than 3 pounds in 2 days, restrict sodium intake to 2 grams per day, take diuretics as prescribed, even if feeling better, avoid taking over-the-counter medications without checking with the provider. This item tests the nurse's understanding of crucial discharge teaching for clients with heart failure. The keywords heart failure and discharge teaching point to interventions aimed at managing symptoms, preventing exacerbations, and promoting self-care. Monitoring for sudden weight gain, adhering to a low-sodium diet, consistently taking diuretics, and avoiding unapproved over-the-counter medications are all vital strategies to prevent fluid overload and medication interactions. Increasing fluid intake is usually contraindicated in heart failure, and while exercise is good, moderate intensity daily might be too much for some, so specific exercise plans should come from the provider. For example, a client who notices their shoes feel tighter after a couple of days should recognize this as potential fluid retention and report it. Remind yourself that heart failure management centers on reducing cardiac workload and controlling fluid balance. Question 5. A nurse is performing a neurological assessment on a client. Which findings are considered normal? Select all that apply. A. Pupils equal, round, reactive to light and accommodation, pearly. B. Bilateral clonus present. C. Absence of Babinski reflex in an adult. D. Glasgow Coma Scale, GCS, score of 15. E. Slurred speech. F. Able to identify a familiar object by touch with eyes closed. Answer. Pupils equal, round, reactive to light and accommodation, pearly, absence of Babinski reflex in an adult, Glasgow Coma Scale, GCS, score of 15, able to identify a familiar object by touch with eyes closed. This question assesses knowledge of normal neurological assessment findings. The key is normal findings in a neurological assessment. PERLA indicates intact cranial nerves and brainstem function. The absence of a Babinski reflex, upward toe movement, is normal in adults. A GCS of 15 signifies full consciousness, and stereognosis, identifying objects by touch, is a normal sensory function. Bilateral clonus, rhythmic muscle contractions, and slurred speech, dysarthria, are abnormal findings requiring further investigation. For instance, asking an adult client to walk heel to toe and observing their steady gait is a quick check for cerebellar function. When assessing neurological status, look for symmetry, appropriate responses, and intact sensory and motor functions. Question 6. A nurse is preparing to administer medications through a nasogastric (NG) tube. Which actions should the nurse take? Select all that apply. A. Crush all medications into a fine powder. B. Check for placement of the NG tube. C. Flush the tube with 15 to 30 milliliters of water before and after each medication. D. Mix all medications together in one syringe. E. Administer medications separately. EF. Aspirate stomach contents to check residual volume. Answer. Check for placement of the NG tube. Flush the tube with 15 to 30 milliliters of water before and after each medication. Administer medications separately. Aspirate stomach contents to check residual volume. This item tests the proper procedure for administering medications via a nasogastric (NG) tube. The keywords NG tube and administer medications indicate a need to follow best practices to ensure client safety and medication efficacy. Verifying tube placement, flushing before and after each medication, administering medications individually, not mixed, and checking residual volume are all essential steps to prevent complications like aspiration and ensure absorption. Crushing all medications is incorrect as some are extended release or enteric-coated and cannot be crushed, and mixing all medications can lead to interactions or clogged tubes. For example, after checking placement, flushing the tube helps ensure patency before giving the first medication. Always prioritize patient safety and medication integrity when administering through an NG tube. Question 7. A client with a new colostomy is receiving discharge teaching. Which statements by the client indicate a need for further teaching? Select all that apply. A. I will empty my pouch when it is about 1/3 full. B. I should change the pouch system every day. C. I can eat anything I want now that I have a colostomy. D. I will contact my doctor if I notice any changes in the stoma color. E. It's normal for the stoma to be dark purple. F. I should cut the wafer opening just slightly larger than the stoma. Answer. I should change the pouch system every day. I can eat anything I want now that I have a colostomy. It's normal for the stoma to be dark purple. I should cut the wafer opening just slightly larger than the stoma. This question evaluates the client's understanding of colostomy care. The keywords colostomy and need for further teaching require identifying incorrect statements that could lead to complications. Changing the pouch daily is too frequent and can irritate the skin. A dark purple stoma is a sign of ischemia and needs immediate reporting, and the wafer opening should fit snugly around the stoma, not be larger, to prevent skin irritation from effluent. Furthermore, clients with colostomies should initially be cautious with their diet to identify trigger foods, not eat anything they want. Emptying the pouch when 1/3 full and reporting stoma color changes are correct practices. For example, a properly fitting wafer prevents digestive enzymes from contacting and breaking down the skin around the stoma, which can be very painful. It's crucial to remember that a healthy stoma is pink or red and moist. Question 8. A nurse is assessing a client for signs of hypokalemia. Which findings should the nurse expect? Select all that apply. A. Muscle weakness. B. Peak T waves on ECG. C. Decreased deep tendon reflexes. D. Abdominal distension. E. Diarrhea. F. U waves on ECG. Answer. Muscle weakness, decreased deep tendon reflexes, abdominal distension, U waves on ECG. This item tests the nurse's knowledge of the clinical manifestations of hypokalemia, which is low potassium in the blood. The key phrase, signs of hypokalemia, directs the nurse to select the physiological effects of inadequate potassium levels. Muscle weakness, decreased deep tendon reflexes, and abdominal distension, due to decreased gastrointestinal motility, are classic signs of hypokalemia, as are prominent U waves on an ECG. Peak T waves are characteristic of hyperkalemia, and diarrhea typically causes potassium loss, not a symptom of low potassium itself. Constipation is more common with hypokalemia. For example, a client with severe hypokalemia might struggle to lift their arms or walk steadily. Remember that potassium is crucial for muscle and nerve function, so low levels affect both. Question 9. A nurse is preparing to insert a peripheral intravenous 4 catheter for an adult client. Which actions are appropriate for the nurse to take? Select all that apply. A. Select a vein in the antecubital fossa for initial insertion. B. Apply a tourniquet 4 to 6 inches above the selected insertion site. C. Cleanse the insertion site with an antiseptic solution in a circular motion, moving inward from the periphery. D. Insert the catheter with the bevel facing down. E. Anchor the vein below the proposed insertion site. F. Flush the catheter with normal saline after insertion. Answer. Apply a tourniquet 4 to 6 inches above the selected insertion site, anchor the vein below the proposed insertion site, flush the catheter with normal saline after insertion. This question assesses the nurse's understanding of correct procedures for inserting a peripheral 4 catheter. The keywords peripheral 4 catheter and appropriate actions highlight the need for safe and effective venipuncture techniques. Applying a tourniquet 4 to 6 inches above the site, anchoring the vein to stabilize it, and flushing the catheter post-insertion to ensure patency are all crucial steps. The antecubital fossa is generally avoided for initial sites as it restricts movement. Cleansing should be in an outward circular motion, and the bevel should face up to facilitate easier insertion and prevent vein damage. For instance, anchoring the vein helps prevent it from rolling, which makes insertion much more successful. Always prioritize proper technique to ensure client comfort and prevent complications during insertion. Question 10. A nurse is providing care for a client with type 1 diabetes mellitus. Which findings indicate the client is experiencing hypoglycemia? Select all that apply. A. Warm, dry skin. B. Fruity breath odor. C. Shakiness. D. Confusion. E. Increased thirst. F. Palpitations. Answer. Shakiness, confusion, palpitations. This item tests the nurse's ability to recognize the classic signs and symptoms of hypoglycemia, low blood sugar, in a client with type 1 diabetes. The keywords hypoglycemia and type 1 diabetes direct the nurse to identify symptoms related to the body's compensatory response to low glucose. Shakiness, confusion, and palpitations are all common manifestations as the body tries to raise blood glucose and the brain lacks adequate fuel. Warm, dry skin, fruity breath odor, and increased thirst are characteristic signs of hyperglycemia, high blood sugar, not hypoglycemia. For example, a client might suddenly feel dizzy and have difficulty concentrating during a hypoglycemic episode. Remember that hypoglycemia is a medical emergency that requires immediate intervention to prevent severe neurological damage. Question 11. A nurse is administering a blood transfusion to a client. Which actions should the nurse take? Select all that apply. A. Initiate the transfusion within 30 minutes of receiving the blood from the blood bank. B. Monitor vital signs every 5 minutes for the first 15 minutes of the transfusion. C. Administer the blood with dextrose 5% in water. D. Use an 18-gauge or larger 4 catheter. E. Document the transfusion only after its completion. F. Stay with the client for the first 15 minutes of the transfusion. Answer. Initiate the transfusion within 30 minutes of receiving the blood from the blood bank. Monitor vital signs every 5 minutes for the first 15 minutes of the transfusion. Use an 18-gauge or larger 4 catheter. Stay with the client for the first 15 minutes of the transfusion. This question assesses the nurse's knowledge of safe practices for administering blood transfusions. The keywords blood transfusion and actions to take emphasize the critical steps for client safety and monitoring for adverse reactions. Starting the transfusion promptly, frequent vital sign monitoring during the initial phase, using an appropriately sized forecatheter, and remaining with the client for the first 15 minutes are all crucial to detect and intervene early if a reaction occurs. Blood should only be administered with normal saline, not dextrose, as dextrose can cause red blood cell lysis, and documentation should be ongoing, not just at the end. For instance, staying with the client allows for immediate assessment of any subtle changes like itching or shortness of breath. Always remember the critical first 15 minutes of a transfusion are key for reaction detection. Question 12. A client with a urinary tract infection, UTI, is receiving discharge instructions. Which information should the nurse include? Select all that apply. A. Drink at least 8 to 10 glasses of water daily. B. Take antibiotics until symptoms disappear. C. Wipe from front to back after urinating. D. Avoid bubble baths and perfumed hygiene products. E. Urinate after sexual intercourse. E. Drink cranberry juice regularly. Answer. Drink at least 8 to 10 glasses of water daily, wipe from front to back after urinating, avoid bubble baths and perfumed hygiene products, urinate after sexual intercourse, drink cranberry juice regularly. This question tests the nurse's understanding of essential discharge teaching for preventing and managing urinary tract infections. The key phrases urinary tract infection and discharge instructions highlight interventions focused on preventing recurrence and promoting urinary health. Encouraging increased fluid intake, proper hygiene, wiping front to back, avoiding irritants like bubble baths, urinating after intercourse to flush bacteria, and regularly consuming cranberry juice, which can inhibit bacterial adherence, are all effective preventive measures. Clients must complete the entire course of antibiotics, even if symptoms improve, to eradicate the infection completely. For example, staying well hydrated helps flush bacteria out of the urinary system. Emphasize that these simple hygiene habits and fluid intake are powerful tools against UTIs. Question 13. A nurse is caring for a client with a nasogastric (NG) tube connected to low intermittent suction. Which assessments are priorities for the nurse? Select all that apply. A. Patency of the NG tube. B. Bowel sounds. C. Skin integrity around the nares. D. Client's level of consciousness. E. Gastric pH. E. Electrolyte balance. Answer. Patency of the NG tube, bowel sounds, skin integrity around the nares, electrolyte balance. This item evaluates the nurse's priority assessments for a client with an NG tube on suction. The keywords NG tube, low intermittent suction, and priorities direct the nurse to focus on potential complications and proper functioning. Ensuring tube patency prevents distension, monitoring bowel sounds assesses gastrointestinal motility, checking skin integrity around the nares prevents pressure injury, and evaluating electrolyte balance is crucial due to potential losses from suction. While level of consciousness is always important, it's not specific to NG tube management in this context, and gastric pH is usually checked to confirm initial placement, not routinely for ongoing suction management. For example, if the NG tube is not patent, the client might experience nausea and abdominal distension, signaling a need for intervention. Remember to assess for proper function of the tube and for potential complications related to its presence and the suctioning itself. Question 14. A client is receiving total parenteral nutrition, TPN, via a central venous catheter. Which nursing interventions are appropriate for this client? Select all that apply. A. Monitor blood glucose levels frequently. B. Change the TPN bag and tubing every 48 hours. C. Administer medications through the TPN line. D. Assess for signs of infection at the insertion site. E. Monitor daily weight. F. Perform sterile dressing changes for the central line. Answer. Monitor blood glucose levels frequently, assess for signs of infection at the insertion site, monitor daily weight, perform sterile dressing changes for the central line. This question addresses the essential nursing care for a client receiving total parenteral nutrition, TPN, through a central line. The keywords TPN, central venous catheter, and appropriate interventions highlight the need for vigilant monitoring and infection control. Frequent blood glucose monitoring is critical due to the high dextrose content of TPN. Assessing for signs of infection at the central line site is paramount. Daily weights monitor fluid balance, and sterile dressing changes prevent central line-associated bloodstream infections. TPN bags and tubing should be changed every 24 hours, not 48 hours, to minimize infection risk, and medications should generally not be administered through the TPN line due to compatibility issues and infection risk. For instance, carefully monitoring blood glucose helps prevent both hyperglycemia and rebound hypoglycemia if TPN is stopped suddenly. Remember that TPN is a high-risk therapy requiring strict aseptic technique and meticulous monitoring. Question 15. A nurse is providing education to a client diagnosed with iron deficiency anemia. Which foods should the nurse recommend to increase iron intake? Select all that apply. A. Spinach. B. Beef liver. C. Milk. D. Oranges. E. Lentils. F. White bread. Answer. Spinach, beef liver, lentils. This item tests the nurse's knowledge of dietary sources of iron for a client with iron deficiency anemia. The keywords iron deficiency anemia and increase iron intake point to foods rich in easily absorbable iron. Spinach, beef liver, and lentils are excellent sources of dietary iron. While oranges are high in vitamin C, which helps with iron absorption, they are not a primary source of iron itself. Milk is poor in iron, and white bread is typically not a good source unless fortified. For example, suggesting a meal of lentil soup with a side of spinach is a great way to boost iron. Always emphasize that consuming vitamin C with iron-rich foods can enhance absorption. Question 16. A nurse is caring for a client post-thyroidectomy. Which findings require immediate intervention? Select all that apply. A. Client reports a sore throat. B. Hoarseness of voice. C. Frequent swallowing. D. Muscle twitching and tingling around the mouth. E. Respiratory stridor. F. A small amount of serosanguineous drainage on the dressing. Answer. Frequent swallowing, muscle twitching and tingling around the mouth, respiratory stridor. This question assesses the nurse's ability to identify critical complications following a thyroidectomy. The keywords post-thyroidectomy and immediate intervention highlight potential life-threatening issues. Frequent swallowing could indicate internal bleeding and hematoma formation. Muscle twitching and perioral tingling are classic signs of hypocalcemia due to parathyroid gland damage, and respiratory stridor indicates airway obstruction, all requiring urgent action. A sore throat and hoarseness are expected post-operative discomforts, and a small amount of drainage is usually normal. For instance, if a client develops stridor, the nurse must immediately assess the airway, call for help, and prepare for potential intubation. Prioritize airway, breathing, and circulation when assessing postoperative clients, especially after neck surgery. Question 17. A nurse is preparing to administer an intramuscular (IM) injection to an adult client. Which principles should the nurse follow? Select all that apply. A. Select a 25-gauge needle for administration. B. Insert the needle at a 45-degree angle. C. Choose the ventrogluteal site for volumes greater than 2 milliliters. D. Aspirate for blood return before injecting the medication. E. Administer the injection into a site with visible bruising. F. Rotate injection sites for repeated injections. Answer. Choose the ventrogluteal site for volumes greater than 2 milliliters, aspirate for blood return before injecting the medication, rotate injection sites for repeated injections. This item tests the nurse's knowledge of safe and effective intramuscular (IM) injection techniques for adults. The keywords IM injection and principles indicate a need to adhere to standard guidelines. The ventrogluteal site is preferred for larger volumes due to muscle mass and distance from major nerves/blood vessels. Aspiration is still recommended by some guidelines to ensure the needle is not in a blood vessel, and rotating sites prevents tissue damage. A 25-gauge needle is typically too small for IM injections, usually 20 to 22 gauge. IM injections are given at a 90-degree angle, and injections should never be given into bruised areas. For example, if a client needs daily IM injections, alternating between the ventrogluteal and deltoid sites helps reduce discomfort and prevent complications. Always prioritize client safety and proper medication delivery when giving IM injections. Question 18. A nurse is educating a client on how to prevent osteoporosis. Which recommendations should the nurse include? Select all that apply. A. Limit weight-bearing exercises. B. Increase calcium intake. C. Stop smoking. D. Avoid vitamin D supplementation. E. Consume alcohol in moderation. F. Engage in regular weight-bearing exercise. Answer. Increase calcium intake, stop smoking, engage in regular weight-bearing exercise. This question evaluates the nurse's knowledge of lifestyle modifications to prevent osteoporosis. The keywords prevent osteoporosis and recommendations point to interventions that promote bone health. Increasing calcium intake, quitting smoking, as smoking decreases bone density, and engaging in regular weight-bearing exercises, like walking or lifting weights, are all crucial for building and maintaining bone mass. Limiting weight-bearing exercises is incorrect, as these strengthen bones, and adequate vitamin D, often through supplementation, is essential for calcium absorption. While alcohol in moderation might be generally acceptable, excessive alcohol consumption can negatively impact bone health. For instance, walking regularly helps put stress on bones, stimulating them to become stronger. Encourage clients to think of bones as needing food, calcium, vitamin D, and exercise, weight-bearing, to stay strong. Question 19. A nurse is reviewing medication orders for a client with hepatic impairment. Which considerations should the nurse keep in mind regarding drug administration? Select all that apply. A. Dosages of highly protein-bound drugs may need to be decreased. B. Medications primarily metabolized by the liver may accumulate. C. Drugs excreted renally will be unaffected by hepatic impairment. D. The client may be at increased risk for drug toxicity. E. First-pass effect may be reduced, leading to higher drug levels. F. Plasma half-life of some drugs may be prolonged. Answer. Dosages of highly protein-bound drugs may need to be decreased. Medications primarily metabolized by the liver may accumulate. The client may be at increased risk for drug toxicity. First-pass effect may be reduced, leading to higher drug levels. Plasma half-life of some drugs may be prolonged. This question tests the nurse's understanding of how hepatic impairment affects pharmacokinetics. The keywords hepatic impairment and drug administration direct the nurse to consider altered drug metabolism and elimination. In liver dysfunction, protein binding capacity can decrease, metabolism of liver metabolized drugs is impaired leading to accumulation, the first pass effect, drug breakdown by the liver before systemic circulation, is reduced, and drug half-life is prolonged, all increasing the risk of toxicity. Drugs excreted renally are primarily processed by the kidneys, but their metabolism can still be affected if they have active metabolites processed by the liver. For example, a lower dose of a benzodiazepine might be needed for a client with cirrhosis because the liver cannot break it down as efficiently, leading to prolonged sedation. Remember that a compromised liver struggles to process medications, requiring careful dose adjustments and vigilant monitoring. Question 20. A nurse is educating a client with chronic kidney disease, CKD, about dietary restrictions. Which foods should the nurse advise the client to limit? Select all that apply. A. Apples. B. Processed meats. C. Dairy products. D. White bread. E. Bananas. F. Carbonated beverages. Answer. Processed meats, dairy products, bananas, carbonated beverages. This question assesses the nurse's knowledge of dietary restrictions for clients with chronic kidney disease, CKD. The keywords chronic kidney disease and limit indicate the need to identify foods high in nutrients that poorly functioning kidneys struggle to excrete. Processed meats, high in sodium and phosphorus, dairy products, high in phosphorus and potassium, bananas, high in potassium, and carbonated beverages, high in phosphorus, should all be limited to prevent electrolyte imbalances and fluid overload. Apples and white bread, typically low in potassium, phosphorus, and sodium, are generally acceptable choices. For instance, a client with CKD should avoid a banana split, as it combines high potassium and high phosphorus foods. Encourage clients to prioritize fresh, unprocessed foods and to consult with a dietitian for personalized guidance. Question 21. A nurse is assessing a client admitted with acute pancreatitis. Which findings should the nurse expect? Select all that apply. A. Severe epigastric pain radiating to the back. B. Jaundice. C. Rebound tenderness. D. Elevated serum amylase and lipase. E. Hyperactive bowel sounds. F. Gray-Turner's sign or Cullen's sign. Answer. Severe epigastric pain radiating to the back, elevated serum amylase and lipase, Gray-Turner's sign or Cullen's sign. This item tests the nurse's ability to identify the classic signs and symptoms of acute pancreatitis. The key phrases acute pancreatitis and expect to find direct the nurse to choose manifestations related to pancreatic inflammation. Severe epigastric pain radiating to the back is a hallmark symptom, elevated serum amylase and lipase are diagnostic indicators, and Gray-Turner's sign, flank bruising, or Cullen's sign, periumbilical bruising, indicate retroperitoneal bleeding, a severe complication. Jaundice can occur if the common bile duct is obstructed, but it is not a direct symptom of pancreatic inflammation itself. Rebound tenderness is more indicative of peritonitis, and bowel sounds are typically diminished or absent due to paralytic ileus, not hyperactive. For example, a client might describe the pain as sharp and constant, worsened by eating. Remember, the pain of pancreatitis is often severe and accompanied by diagnostic lab changes. Question 22. A nurse is caring for a client with a history of seizures. Which interventions should the nurse prioritize during a tonic-clonic seizure? Select all that apply. A. Restrain the client's limbs to prevent injury. B. Place a tongue blade in the client's mouth. C. Turn the client to their side. D. Protect the client's head. E. Note the time the seizure began and ended. F. Provide privacy. Answer. Turn the client to their side, protect the client's head, note the time the seizure began and ended, provide privacy. This question focuses on the immediate nursing priorities during a tonic-clonic seizure. The keywords tonic-clonic seizure and prioritize emphasize client safety and observation. Turning the client to their side helps maintain an open airway and prevent aspiration. Protecting the head minimizes injury. Noting the seizure duration is crucial for monitoring, and providing privacy helps maintain dignity. Restraining limbs and inserting a tongue blade are dangerous and contraindicated actions that can cause injury to the client. For instance, gently cushioning the client's head with a pillow helps prevent head trauma against hard surfaces. Always remember that safety and observation are paramount during a seizure, and never force anything into the client's mouth. Question 23. A nurse is caring for a client prescribed digoxin. Which findings indicate the client may be experiencing digoxin toxicity? Select all that apply. A. Bradycardia. B. Nausea and vomiting. C. Visual disturbances, e.g., yellow-green halos. D. Diarrhea. E. Hyperkalemia. F. Tachycardia. Answer. Bradycardia, nausea and vomiting, visual disturbances, e.g., yellow-green halos, diarrhea. This item tests the nurse's ability to recognize signs of digoxin toxicity. The keyword digoxin toxicity directs the nurse to identify adverse effects of this cardiac glycoside. Bradycardia, slow heart rate, nausea, vomiting, and characteristic visual disturbances like yellow-green halos are classic signs of digoxin toxicity. Diarrhea can also be a gastrointestinal symptom. Tachycardia is generally not a sign of digoxin toxicity, rather, it often causes bradycardia. Hyperkalemia can exacerbate digoxin toxicity, but it is not a direct symptom of the toxicity itself, and hypokalemia is a risk factor. For example, if a client reports seeing halos around lights and has a heart rate of 50 bpm, the nurse should suspect toxicity. Always remember to check the apical pulse before administering digoxin and be aware of its narrow therapeutic window. Question 24. A nurse is caring for a client with a new prescription for metformin. Which instructions should the nurse include in the client's teaching plan? Select all that apply. A. Take the medication with food to reduce gastrointestinal side effects. B. It is important to monitor for signs of hypoglycemia. C. Stop taking the medication 48 hours before any iodine contrast radiologic study. D. Alcohol consumption should be limited. E. This medication can cause weight gain. F. It is normal to experience a metallic taste in the mouth initially. Answer. Take the medication with food to reduce gastrointestinal side effects. Stop taking the medication 48 hours before any iodine contrast radiologic study. Alcohol consumption should be limited. It is normal to experience a metallic taste in the mouth initially. This question focuses on crucial teaching points for a client starting metformin. The keywords metformin and teaching plan emphasize the need for client education regarding administration and potential adverse effects. Taking it with food reduces common GI upset. Discontinuing before contrast studies prevents lactic acidosis. Limiting alcohol reduces lactic acidosis risk, and a metallic taste is a known initial side effect. While hypoglycemia is a concern with many diabetes medications, metformin itself typically does not cause hypoglycemia when used alone. Metformin often leads to modest weight loss or is weight neutral, not weight gain. For example, if a client is scheduled for a CT scan with contrast, reminding them to pause their metformin is a vital safety measure. Highlight the importance of adherence and knowing when to hold the medication for specific procedures. Question 25. A nurse is caring for a client with suspected appendicitis. Which assessment findings would support this diagnosis? Select all that apply. A. Rebound tenderness at McBurney's point. B. Right lower quadrant pain. C. Nausea and vomiting. D. Decreased white blood cell count. E. Abdominal distension. F. Fever. Answer. Rebound tenderness at McBurney's point, right lower quadrant pain, nausea and vomiting, fever. This item tests the nurse's knowledge of the classic signs and symptoms of appendicitis. The keywords suspected appendicitis and support this diagnosis direct the nurse to identify typical clinical presentations. Rebound tenderness at McBurney's point, midway between the umbilicus and the right iliac crest, right lower quadrant pain, nausea, vomiting, and a low-grade fever are all characteristic findings. A white blood cell count is typically elevated, not decreased, due to the inflammatory process, and while abdominal distension can occur, it is not as specific or common as the other key indicators for appendicitis. For instance, pressing on McBurney's point and feeling pain upon release is a strong indicator. Remember that appendicitis is often a medical emergency, and these symptoms warrant prompt evaluation. Question 26. A nurse is providing discharge teaching to a client diagnosed with peptic ulcer disease, PUD. Which statements indicate that the client understands the teaching? Select all that apply. A. I will avoid aspirin and ibuprofen. B. I should drink milk frequently to coat my stomach. C. I will limit my intake of caffeine and alcohol. D. I need to complete the full course of my antibiotics. E. Stress does not play a role in my ulcer. F. I will eat 3 large meals a day. Answer. I will avoid aspirin and ibuprofen. I will limit my intake of caffeine and alcohol. I need to complete the full course of my antibiotics. This question evaluates the client's understanding of self-management strategies for peptic ulcer disease, PUD. The keywords peptic ulcer disease and understands the teaching highlight effective measures for healing and preventing recurrence. Avoiding NSAIDs like aspirin and ibuprofen, limiting caffeine and alcohol, which can irritate the stomach, and completing antibiotics, if H. pylori is present, are all crucial for managing PUD. Milk might provide temporary relief but can stimulate acid production. Stress is a known exacerbating factor, and eating smaller, more frequent meals is generally recommended over 3 large ones. For example, choosing acetaminophen instead of ibuprofen for pain relief protects the gastric lining from further damage. Emphasize that these lifestyle and medication changes are vital for ulcer healing and prevention. Question 27. A nurse is caring for a client experiencing an anaphylactic reaction. Which interventions should the nurse prioritize? Select all that apply. A. Administer diphenhydramine orally. B. Maintain a patent airway. C. Administer epinephrine intramuscularly. D. Place the client in a supine position with legs elevated. E. Administer 4 fluids. F. Initiate continuous cardiac monitoring. Answer. Maintain a patent airway, administer epinephrine intramuscularly, place the client in a supine position with legs elevated, administer 4 fluids, initiate continuous cardiac monitoring. This question tests the nurse's ability to prioritize interventions during a life-threatening anaphylactic reaction. The keywords anaphylactic reaction and prioritize call for immediate, critical actions. Maintaining a patent airway, administering intramuscular epinephrine, the primary treatment, placing the client supine with legs elevated to improve circulation, administering 4 fluids to combat vasodilation, and initiating cardiac monitoring are all essential, life-saving interventions. Oral diphenhydramine is too slow and not a priority in an emergency, for diphenhydramine might be used later but epinephrine is first. For instance, if a client reports sudden shortness of breath and hives after a medication, immediate administration of epinephrine can rapidly reverse bronchospasm and hypotension. Remember that anaphylaxis is a medical emergency requiring rapid assessment and intervention to preserve life. Question 28. A nurse is assessing a client with diverticulitis. Which findings should the nurse expect? Select all that apply. A. Left lower quadrant pain. B. Rebound tenderness. C. Nausea and vomiting. D. Bloody diarrhea. E. Fever. F. Constipation or diarrhea. Answer. Left lower quadrant pain, nausea and vomiting, fever, constipation or diarrhea. This item assesses the nurse's knowledge of the clinical manifestations of diverticulitis. The keyword diverticulitis directs the nurse to identify symptoms related to inflammation or infection of the diverticula. Left lower quadrant pain is the most common symptom, often accompanied by nausea, vomiting, and fever. Bowel habits can vary, with either constipation or diarrhea being reported. Rebound tenderness indicates peritonitis and is a sign of a more severe, possibly perforated, diverticulum, requiring urgent attention, but is not an expected finding for all cases. Bloody diarrhea is more commonly associated with inflammatory bowel disease or ischemic colitis. For example, a client might describe a cramping pain in their lower left abdomen that is relieved by bowel movements. Focus on identifying the common signs of inflammation and infection in the colon. Question 29. A nurse is providing care for a client with a full-thickness burn. Which interventions are appropriate for the nurse to perform? Select all that apply. A. Apply ice to the burn area to reduce pain. B. Cover the burn with a clean, dry dressing. C. Administer intravenous fluids as prescribed. D. Monitor for signs of hypovolemic shock. E. Remove any clothing or jewelry from the burn area. F. Administer pain medication as ordered. Answer. Cover the burn with a clean, dry dressing, administer intravenous fluids as prescribed, monitor for signs of hypovolemic shock, remove any clothing or jewelry from the burn area, administer pain medication as ordered. This question tests the nurse's immediate and essential interventions for a client with a full-thickness burn. The keywords full-thickness burn and appropriate interventions highlight the priorities of preventing infection, managing fluid balance, and alleviating pain. Covering the burn with a dry dressing, administering 4 fluids to prevent shock, vigilant monitoring for hypovolemia, removing constricting items, and administering pain medication are all critical actions. Applying ice is contraindicated as it can cause further tissue damage. For instance, a client with a large burn will quickly lose fluids, so starting 4 fluids proactively is vital. Remember that the priorities for burns are stopping the burning process, pain management, fluid resuscitation, and infection prevention. Question 30. A nurse is performing a mental status examination on a client. Which components are typically assessed? Select all that apply. A. Appearance and behavior. B. Thought processes. C. Nutritional status. D. Mood and effect. E. Orientation. Eve. Socioeconomic status. Answer. Appearance and behavior, thought processes, mood and effect, orientation. This item evaluates the nurse's understanding of the key components of a mental status examination, MSE. The keywords mental status examination and components direct the nurse to identify the core elements used to assess cognitive and emotional functioning. Appearance and behavior, thought processes, how thoughts are formed and organized. E. Mood, subjective feeling, affect, objective expression of emotion, and orientation, awareness of person, place, time, and situation, are all fundamental parts of an MSE. Nutritional and socioeconomic status are important for a comprehensive health history but are not direct components of the MSE itself. For example, asking a client "What is your name?" and "Where are you right now?" assesses their orientation. The MSE provides a snapshot of a client's current psychological functioning. Question 31. A nurse is providing education on wound care to a client with a stage 2 pressure injury. Which statements indicate that the client understands the teaching? Select all that apply. A. I will change my dressing every other day. B. I should keep the wound moist to promote healing. C. I will reposition myself every hour while awake. D. I can use hydrogen peroxide to clean the wound. E. I will increase my protein and vitamin C intake. F. I will report any signs of increased redness or warmth around the wound. Answer. I should keep the wound moist to promote healing. I will reposition myself every hour while awake. I will increase my protein and vitamin C intake. I will report any signs of increased redness or warmth around the wound. This question tests the client's understanding of proper wound care and prevention for a stage 2 pressure injury. The keywords stage 2 pressure injury and understands the teaching highlight essential elements for healing and preventing complications. Maintaining a moist wound environment, frequent repositioning to relieve pressure, increasing protein and vitamin C intake for tissue repair, and promptly reporting signs of infection, like redness or warmth, are all correct practices. Dressing change frequency depends on the type of dressing and exudate, not a fixed every other day schedule. Hydrogen peroxide is cytotoxic and should not be used on open wounds as it impairs healing. For instance, explaining that a slightly moist wound allows new cells to grow across it more easily helps clients understand the rationale. Remember that proper nutrition, pressure relief, and infection control are paramount for pressure injury healing. Question 32. A nurse is administering an intravenous push, IVP, medication. Which steps are appropriate for the nurse to take? Select all that apply. A. Administer the medication as fast as possible to ensure rapid action. B. Check for blood return before and after administration. C. Dilute all 4 push medications with 10 milliliters of normal saline. D. Flush the 4 line with normal saline before and after the medication. E. Administer the medication at the recommended rate. F. Assess the 4 site for signs of infiltration or phlebitis before administration. Answer. Check for blood return before and after administration. Flush the 4 line with normal saline before and after the medication. Administer the medication at the recommended rate. Assess the 4 site for signs of infiltration or phlebitis before administration. This item evaluates the nurse's knowledge of safe practices for administering intravenous push, IVP, medications. The keywords intravenous push and appropriate steps emphasize client safety and proper technique. Checking for blood return, flushing before and after, administering at the recommended rate, and assessing the 4 site are all crucial steps to ensure the medication goes into the vein safely and effectively. Administering as fast as possible can cause adverse reactions, and not all 4-push medications require dilution, with some even having specific diluent requirements. For example, before giving an 4-push opioid, the nurse must ensure the 4 is patent to prevent extravasation, which could cause tissue damage. Always prioritize patient safety by confirming 4 patents and adhering to proper administration rates. Question 33. A nurse is teaching a client about self-administration of insulin. Which instructions should the nurse include? Select all that apply. A. Rotate injection sites within the same general area. B. Store unopened insulin vials in the refrigerator. C. Aspirate for blood return before injecting. D. Always use the abdomen as the preferred injection site. E. Pinch the skin before injecting if the client is very thin. F. Discard opened insulin vials after 28 days, even if some insulin remains. Answer. Rotate injection sites within the same general area, store unopened insulin vials in the refrigerator, pinch the skin before injecting if the client is very thin, discard opened insulin vials after 28 days, even if some insulin remains. This question tests the nurse's knowledge of safe and effective insulin self-administration. The keywords self-administration of insulin and instructions highlight important techniques and storage guidelines. Rotating injection sites prevents lipodystrophy, storing unopened vials in the refrigerator maintains potency, pinching the skin for thin clients helps ensure subcutaneous injection, and discarding open vials after 28 days, or per manufacturer guidelines, prevents loss of potency. Aspiration is not necessary for subcutaneous injections, and while the abdomen is a common site, other areas like the thighs and arms should also be used for rotation, not just the abdomen. For instance, explaining that using the same spot repeatedly can make insulin less effective there encourages proper site rotation. Emphasize that consistent technique and proper storage are crucial for blood glucose control. Question 34. A nurse is providing education to a group of clients about reducing the risk of developing sexually transmitted infections, STIs. Which information should the nurse include? Select all that apply. A. Abstinence is the only 100% effective method to prevent STIs. B. Condoms provide protection against all STIs. C. Regular STI screening is recommended for sexually active individuals. D. Discuss sexual history with partners before engaging in sexual activity. E. Vaccination can protect against some STIs. F. Oral contraception prevents the transmission of STIs. Answer. Abstinence is the only 100% effective method to prevent STIs. Regular STI screening is recommended for sexually active individuals. Discuss sexual history with partners before engaging in sexual activity. Vaccination can protect against some STIs. This item assesses the nurse's knowledge of comprehensive strategies for preventing sexually transmitted infections, STIs. The keywords reducing the risk of developing STIs and information to include emphasize education on safe practices and prevention. Abstinence is indeed the only method that guarantees 100% prevention. Regular screening is crucial for early detection and treatment. Open communication about sexual history promotes informed choices, and vaccinations, like HPV vaccine, offer protection against specific STIs. Condoms reduce the risk but do not offer 100% protection against all STIs, e.g., those spread by skin-to-skin contact like herpes, and oral contraception prevents pregnancy but does not protect against STIs. For example, explaining that using condoms correctly every time significantly lowers the risk, but doesn't eliminate it entirely, sets realistic expectations. Always reinforce that a combination of strategies offers the best protection. Question 35. A nurse is preparing to administer medications to a client with a feeding tube. Which actions are appropriate for the nurse to take? Select all that apply. A. Administer sustained-release medications through the tube after crushing. B. Flush the tube with 30 milliliters of water before and after each medication. C. Obtain liquid forms of medications whenever possible. D. Elevate the head of the bed to at least 30 to 45 degrees. E. Mix all medications together to save time. F. Check residual volume before administering medications. Answer. Flush the tube with 30 milliliters of water before and after each medication. Obtain liquid forms of medications whenever possible. Elevate the head of the bed to at least 30 to 45 degrees. Check residual volume before administering medications. This question tests the nurse's understanding of safe medication administration via a feeding tube. The keywords feeding tube and appropriate actions highlight practices to prevent complications and ensure medication effectiveness. Flushing the tube, using liquid medications when available, elevating the head of the bed to prevent aspiration, and checking residual volume are all crucial steps. Sustained-release medications should never be crushed as it alters their pharmacokinetics and can lead to toxicity. Mixing all medications together is also contraindicated due to potential interactions or tube occlusion. For instance, elevating the head of the bed helps use gravity to keep the stomach contents down, significantly reducing the risk of aspiration. Always prioritize client safety and proper medication delivery when administering via feeding tubes.